Thank you, Romuald. Good morning, everybody. I might start by saying Nala Kadich Wajok Nyunga Murt, Kain Kadak Nijbuja. Can I too acknowledge that we're in the land of the Wajok people of the Noongar Nation today and pay my respects to elders past, present, emerging. And thank you, Robin, for your welcome this morning, and can I acknowledge all First Nations people in the room. Of course, as the Governor said, everybody in this room is important today, but I will take the opportunity to acknowledge a number of people, including His Excellency, the Honourable Chris Dawson, AC, APM, the Governor of Western Australia, and Mrs Dawson, the co-patrons of the RAIN study, to the Vice-Chancellor. Thank you for having us. And indeed, the three Deputy Vice-Chancellors who are here, Caroline Finch, Anna Nowak and Peter Eastwood from three universities around the state. I can acknowledge Malcolm McCusker, AC, CVO, KC, and Tony McCusker, AM, who are here, I guess, representing the McCusker Charitable Foundation, Elizabeth Perrin from the Stan Perrin Charitable Foundation, and to everybody else, but particularly to those participants, those study participants, because without you, we wouldn't be here today. The RAIN study is medical research at its best. And having commenced in 1989, I should say 1989 was a good year. It was the year I came to Australia as a teenager. So I'll remember it dearly. So 35 years is an amazing innings for an organisation like this. It is remarkable because of its longevity. And the study is globally recognised as one of the longest pre-birth longitudinal cohort health studies. And of course, over the last 3 decades, it has made many important discoveries, resulting in more than 650 peer-reviewed papers published in academic journals around the world. And the research undertaken by the RAIN study has both advanced science and improved lives. And I'd like to take this opportunity to commend the research team, but also the participants of this world-leading multi-generational study, which continues to this day to improve health outcomes both here and around the globe. The Cook Government is committed to further developing and enriching the vital research sector that we have, and to ensure that the findings and the outcomes can be translated into concrete benefits for Western Australians from benchtop to bedside. Today, findings from the RAIN study and follow-up studies are used by researchers nationally and internationally to explore a vast range of topics and groundbreaking discoveries, such as ultrasounds on women in pregnancy, to find out ultrasounds on women in pregnancy are safe, children who participate in more sport have stronger bones as adults, children conceived from IVF have the same long-term health outlook as those conceived naturally, teenagers with healthier diets have better school achievement, and poor sleep is a risk factor for conditions such as cardiovascular disease, diabetes, depression, and poor mental health. And these results have been made possible through the assistance of around 2,000 extraordinary West Australians over 3 generations. Results from the RAIN study have influenced international public health policies, such as recommendations on maternal smoking, physical activity, and dietary habits, all from here in Western Australia, this tiny place in the corner of the globe, yet so much of the world's science is emanating from here, and it really is something that we should be proud of after all of these years. The RAIN study's accomplishments really do epitomise what the state government is aiming to foster in the local research and innovation space. First-rate research, cross-industry collaboration, and consumer-driven innovation that enhances the delivery of care towards better health. Now, I'm sure many of you are familiar with the Future Health Research Innovations Fund. It's something I am incredibly proud of. Since its inception over the last 4 years, we've delivered about $185 million to about 627 to be exact, researchers and innovators who do amazing work. And over the next 4 years, we do have $250 million in the fund to give out to our researchers. So if you haven't looked into it, please do come along to one of our open days. Google it. When I now get to travel across the country to talk to my colleagues, while places like Victoria might be ahead of us, I think we've got more money on the table at the moment, and I want it put to good use, as people in this room, many already are. Today I want to take the opportunity to also just mention that we are now looking to establish the largest biomedical precinct in the Southern Hemisphere. And so located in and around the QE2 medical site. It's a perfect location for this industry-changing development. It also follows on our previous announcement to develop an improvement plan with UWA for the UWA QE2 site. It leverages the incredible network of medical research institutes, healthcare providers and universities, including the University of Western Australia and the in development Edith Cowan Perth campus. The precinct will encourage co-location of world-leading researchers and innovators, giving them access to state-of-the-art infrastructure to help drive transformational research. And so to inform the next steps, the Department of Health has started targeted consultation with critical stakeholders, and this biomedical precinct will further bolster the medical research and innovation that is taking place in this state. And I certainly look forward to sharing further updates with you as the consultation progresses. The RAIN study has a remarkable collection of health data from thousands of participants and the key to its longevity really is its people and the partnerships that they've secured. This outstanding study significantly bolsters the state's research and innovation capabilities. It also provides tremendous benefit to collaborative medical researchers. And now as the generations follow-up study is underway, which will collect samples from 2 generations at the same time, I look forward to the future successes achieved by people here today. This symposium brings together RAIN study researchers, participants and stakeholders to share findings, to discuss future research opportunities and to showcase the amazing achievements of the study. I have no doubt that we'll be in awe of the work that is taking place here when we hear from the researchers who will share their journeys, but also their discoveries shortly. Can I say I hope you're all as inspired as I am by the impact that the RAIN study delivers every single day. And I wish you all the best for the symposium, and I want to say happy birthday, RAIN study. Thanks very much.